Right on.
All right.
Okay,
All right,
Doc.
thanks, Doc.
We got your Dr. Ho on the line. Thank you, Dr. Vince.
All right.
All right.
Be
Well,
safe.
he woke up on the right side of the bed. I mean, Dr. Vince Akimoto saying be positive. That's Dr. Hoa, good morning.
Dr. Hoa, half a day.
Yeah, a good half a day, Suprema.
Are you okay?
I'm okay. Yes,
Okay.
Uh-huh.
You sound
Okay,
like
so
you're exhausted, and
we're-
I'm sure you probably are.
Right. Doc, I kind of had a question I've been holding for the week with the COVID-19 kids who have tested positive. What can parents expect, and how worried should they be?
The kids are usually doing better than adults, so the parents just need to work with the pediatrician there and keep an eye on if he's have problem breathing or not. But kids are usually doing okay. It's the parents that try not to catch the virus from the kids, especially if you have some grandparents in the house. We've been telling the family that keep the grandkids away from the grandparents. So that's the most vulnerable population we have there.
Right.
What about kids with pre-existing medical conditions like asthma or?
They still doing pretty good, Chris. The kids relatively doing pretty good. We have a lot of adults that have the same thing, but more likely in adults that they have some event. But I don't think that we lose so many kids, even in the United States.
Mm-hmm. Yeah, well, I think what was concerning for me is that when Linda was breaking down the connections to the kids that were sick, there was like a birthday party she mentioned, and I'm not sure where this birthday party was or how many kids may have been there, and just kind of makes me wonder if we're going to see even more children.
Yes, I mean that's the unfortunate part. Some people still not heed the warning, and they still have those parties or get together. We just really wanted to put the message out there that the action you did, you're gonna lose someone dear and love to you, especially the elderly, just because you get a whole bunch of kids, whole family together.
Mm-hmm.
So everyone looked fine, but you had to pretend like the person next to you had a COVID-19. So if you decide to do a birthday party or whatever event you're trying to do.
Well, Easter's this weekend. That's why I
yeah.
wanted to just make sure we stress and put the word out to people that don't even think about having an Easter party or anything.
It's not. You're going to lose your parents. You're going to lose your grandparents. You lose your neighbor. And respect them because you want to see them back next year. You don't want to lose them in the next few weeks. So really, people can be asymptomatic and have absolutely no symptom around you, but if you give to the elderly, the fragile one, you won't see them. So love the family, love your parents, love your grandparents, love your neighbor, and respect them by not any type of event that put people together.
Right.
So you really have to stress that a lot of this. We have our culture in Guam that we tend to get there for this event. But I tell you, social distance is so important now, along with masks and hand washing, that please do not do this. We have many more Easter to come. Just skip this one. Separate your family at home by itself. Again, keep away from your grandmother, your grandfather, because they're so high risk right now. And that's why I tell, keep your grandchildren 6-10 feet away from you. Just tell them they love you, but don't hug them for now.
Mm-hmm.
Well, Doc, how are you guys doing with the testing at your clinics?
We're doing very good. Chris, we kind of run low on the actually not the test itself, but the test kit. It's it have to be everyone run low. Public health run low, DLS run low, just because we've been using more than it's supposed to be. So we right now try to save those for the most needed one, like the one in the hospital, or the one that we deem very sick at the clinic level. But I asked the doctor to try not to swab everybody, especially the asymptomatic one, because conserve those things. Now, we have a rapid kit test that's hopefully come up next week here, and we put together a plan of who we're going to use it for. We have to use it very meaningfully to make sure that we work with public health to try to track the positives, and we have to do some spot check, make sure that the kids don't have any false negative or false positive. So that's a plan that we're going to talk about tonight with the Governor Advisory Board and try to implement this thing hopefully next week.
Can you explain a little bit more about this rapid test kit? Is it like a swab and you're done, or you get the results instantaneously, or you still have to wait?
No. This one is measure the antibodies, so it's your IgM, IgG. So it's like a screening test. It's not like a confirmatory test. So it's a screening test. So basically, it's like an accuracy check. You just need one drop of blood, and you can figure it out about 10-15 minutes to see if you have the antibody or not. Again, this is a screening test. It doesn't tell you for sure that you have it. You know, if you want to kind of confirm that, then you have to still do the swab, the nasopharyngeal swab, to confirm it. But at least, you can screen somebody. Just like when you come in to have, like, you have a sore throat and you're doing rapid strep, rapid flu, those things are not confirmed, but those are screening. But the screening sometimes are very good. So you just have to have a physician have good judgment, decide who to give it to. Okay, and if you think that the patient looks sick, but the test is negative, then you have to work with public health to try to swap this patient to make sure the test doesn't give you a false negative.
How does this work? So the government of Guam, public health receives the rapid test kits, and then it deploys it out to the health centers?
Right now, we try to get government of Guam to purchase this, and basically designate certain clinics to do the testing. You want to control, the test kit, and because if we pass it on to everybody, everyone's going to use it sometime unnecessary to asymptomatic patients, and so we waste a test kit. One is kind of far and few. You got to use it, in a meaningful way. Again, you have to use it in accordance with public health. And working with them, and I know there's a lot of companies want to take this in, test their employee. I tell you, that's very dangerous thing to do, because you can test negative one day, send the person back to work, and the next day they will get infected.
So then would our money be better spent on getting the regular test kits as opposed to the rapid test kits?
The regular test kit is far and few still. So right now, just like we don't receive thousands and thousands of those regular test kits from CDC to come in. But let's say that just a person like you, still young, have no comorbidity at all, and you come in, have some cold symptom or maybe some low-grade fever, more likely I'm not going to use a regular test kit on you, just because I want to save that for a person that have more comorbidity that will not do well.
Right.
So I just tell you, go home, stay home for 2 weeks or so, and if you have worse symptoms, you call me back. But you are a person that perfectly come in, have some low-grade fever, some coughing. Yes, I want to do the initial test kit on you because, like I say, it's a screening test. So you're a perfect candidate for mild symptoms that we don't usually use a regular test kit, but now we can do the rapid test kits on you.
How far away are we in seeing these rapid test kits on Guam?
It's supposed to sometime arriving this Friday or early next week. So right now it's to work with Guam to secure a fund source to get it. When they have a wholesale place in town to bring it in, it's just that the government needs to move very fast to get our funding to secure this thing.
Okay.
Wow.
So the meeting with the Physicians Advisory Group is tonight with Public Health and the Governor?
Are we going to live stream that, Doc?
No. That's closed door, but the governor will not be there.
Okay.
Public health will be there. There's about 12-15 physicians on the group, and we just come up with some recommendation for her, and we pass it on to Dr. Mike Cruz, and bring it up to her.
And real quickly before we let you go, because we've got Dr. Felix Cabrera holding, somebody is asking us, can you get COVID more than once?
I think that one is still up in the air. You have one answer now, and then next week someone will give you a different answer. But right now, from my understanding, you got immune to it. But like I say, the COVID-19 psychosis symptoms change in many ways. So the question is, the answer is never, never. There's high possibility you can if they're changing.
Okay. All right. Thank you so much, Dr. Hoa.
You're welcome.
Okay.
Have a good day, guys.
You too,
too.
Doc.
Be
Hang in
safe.
there. Wash your hands, okay?
Okay, thank you.
Okay.
Wear the mask.
Yeah.
Thank you, guys.
Got
Okay,
it.
bye-bye.
There you go, Dr. Hoa from American Medical Center. 7:30.
He's a great guy.
He is
I have to tell you, he's
yeah.
really great.
So we catch up with him tomorrow
Okay.
because they're having that Physicians Advisory Council meeting tonight.
And he said Friday, right? The rapid test kits.
Right.
Should
And
be
so
a